Bismillahirrahmanirrahim. Welcome to my YouTube channel. I am Dr. Talat Chaudhary. This lecture is about MANTRELS, Alvarado. This score is for acute appendicitis. In Alvarado or MANTRELS, there is total score of 10, 3 symptoms, 3 sign, and 2 labs. If the score is 7 or greater than 7, it is strongly predictive of acute appendicitis. And if the score is between 5 and 6, either 5 or 6, then ultrasonography or CECT, CT abdomen with IV contrast should be done, which reduces the rate of negative appendicectomy. So if the score is 4 or less than 4, it is less likely that the patient is having acute appendicitis. So in MANTRELS there are 3 symptoms, 3 signs and 2 labs. The first symptom is migratory right iliac fossa pain, having 1 score, anorexia having 1 score, nausea and vomiting having 1 score. And there are 3 signs, that is tenderness, rebound tenderness and elevated temperature. Tenderness has 2 score, rebound tenderness and elevated temperature both having 1 score. Leukocytosis has 2 score and shift to left curve has 1 score. So if the score is 7 or greater than 7, it is strong predictive of acute appendicitis. If the score is between 5 and 6, ultrasonography and CECT should be done to reduce the rate of negative appendicectomy or appendectomy. If the score is 4 or less than 4, it is less likely for acute appendicitis. Thank you so much. Allah Hafiz.